continue with the multidisciplinary healthcare team, second part, and we'll continue from values, principles, and benefits. So the values needed in an effective team member harmonize with the core competence domain of values and ethics. So in any effective team, the values needed for an effective team are supposed to be in harmony with the values and ethics. So these values and ethics are supposed to be in harmony with were put forward in a meeting. So these values and ethics were put forward in a meeting which was sponsored by International Professional Education Collaborative. And these values and ethics have been called team based competences. So there are basically five personal values that characterize the most effective members of a high functioning team. So these are values which characterize members, not a team itself. So these values are in harmony with the values and ethics which were put by a collaborative team which was sponsored by International Professional Education Competences, and they are called team based competences. So let's get to look at those five of them. So first I'm going to outline them and then we'll be able to talk about them. So the first one is honesty. The second one is discipline. And then we have got creativity. Humility. And then curiosity. So these are some of the characteristics, the five of them, that each team member in a successive and effective team must have. Now, what about honesty? What does it mean for an effective team where team members are honest? A high value is put on effective communication within the team, including transparency about aims, decisions, uncertainty, and mistakes. Honesty is critical to continuous development and for maintaining the mutual trust. Someone who is not honest cannot be trusted. Like they never say the truth. So this characteristic is critical for continuous development. Apart just from development, it is also one important characteristic for maintaining mutual trust. You cannot trust someone who is not honest. Next time, they are going to also do the same thing that they failed to be honest on with you. So, this is very, very important for a high functioning team. Honest is very important for continuous development and mutual trust. And for a team that doesn't trust themselves, it is very, very difficult to get to achieve goals or aims. That is because a team has got the same aim. So if you don't trust each other, it means even if the other one is failing to accomplish, you'll not be able to help them through. You don't trust them. So that is why it is important to be honest as a member of the team to make sure that you get to achieve the goals. Apart from that, we've got discipline. So team members carry out their roles and responsibilities with discipline, even when it seems inconvenient. Such discipline allows teams to develop and stick to their standards. So discipline helps a person to stick to standards. One important thing. I think this is one thing that every person should get to develop. You need to be able to stick to your standards. A lot of people get to change when they get to be in new places. Perhaps they think people do not know me in here, so I can do another thing. So it is very, very important to stick to standards. That is what is called discipline. So such discipline allows team members to take to standards and protocols, even as they see ways to improve. So you get to stick to your standards as you look for ways in which to improve, to do better. So discipline is very, very important in a successive team or an effective team. There is also creativity. So creativity, team members are excited and motivated to tackle emerging problems creatively. They see even errors and some unanticipated bad outcomes as potential opportunities for improvement. That is creativity. You are seeing, you are seeing errors and anticipated bad outcomes as possible opportunities. So that is anticipated bad outcomes as potential opportunities in the near future as you continue to do what you are doing to achieve your goal. So when you are one person who gets to run away from errors and just anticipated bad outcomes, maybe if I get to do this, what of if this happens? What of this happens? What of if I fail to do it? So someone who is creative is going to see even some things that you are seeing maybe might not work out. That is anticipated bad outcomes. What you think might come out badly. You take it as a potential opportunity for improvement. You can use that same thing that you might be able to fail to do better next time. That is creativity, not where you got to run away from what you cannot do or what you think cannot go in the right way. That is not good for a member of an effective team. So creativity is needed. And this gets to excite and motivate just members to tackle emerging problems. That is why there is need of creativity. If there are a lot of problems which are getting to emerge, that is going to creativity is going to motivate you. How are we going to tackle them? You are creative in finding ways and means of making sure that the things that are emerging are handled. So when you talk about humility, team members do not believe that one type of training or perspective is uniformly superior to the training of others. Though they recognize differences in training, they also recognize that they are human and will make mistakes. Hence, the key value of working in a team is that fellow team members can rely on each other to help recognize and avert failures regarding of where they are in hierarchy. So humility has to talk about your hierarchy. There are other people just in a team who have got very, very big positions. Other people have got very low positions. So in order to achieve something, you need to have that personal humility to forget about your hierarchy and consider that everyone is superior. You are not superior to anyone. So because a lot of times when we talk about hierarchy, there is a feeling of superiority. I'm better than this, I'm higher than this. So humility has to be there. So you'll be willing also to get down, to lower your standards, so that you just get to help someone. You pull someone up. You know that you want to achieve a common goal. So that is the importance of having humility in a team. It will make people to get to achieve goals. Now, there is also need for curiosity in a team. So, curiosity team members are dedicated to reflecting upon the lessons they learned in their daily activities and using the reflective experience in continuous professional development and the functioning of the team. So, you need to be curious. Team members are dedicated to reflecting. So, you get to dedicate yourself to reflecting just about some experiences. So get to reflect upon lessons and just the things that got to happen in the course of the operation. And you get to reflect also on all lessons that you learned. That is to be curious. You are curious. The reason as to why you are reflecting and dedicated on just thinking about what you learned is you want to learn more. So as a team member, you need to have that curiosity to make sure that you get to learn a lot of things. So that is one thing that is very, very important as a team member. Okay. So before we get even to look at the effects, the challenges faced by a team, let's look at some principles of team-based healthcare. So we've looked at those values which are supposed to be possessed by every member of a team, and there are the five of them. We need to know them by heart. So now, what are the principles of team-based healthcare? All right, so let's get to look at that. Principles of team-based healthcare. So there are many models to describe effective teamwork. Historically, these have come from industries such as the aviation crew resource management, the principle that characterize a successive team based healthcare include. Now, before we get to look at those, so we are saying there are many models to describe effective teamwork. There are a lot of ways, there are a lot of models, there are a lot of things that you can look at to describe a team that is effective. So, in history, some of these come from other industries, such as the aviation crew resource management, which is abbreviated as CRM. So, I'm saying this is the aviation crew resource management. So, this is one of the models to describe the effectiveness of a team. Aviation crew management. Now, let's get to look at these principles of an effective team. So the principles that characterize a successive team-based healthcare include the first one, shared goals. This is one principle. There is need to share goals. That is because your aim is to achieve the same thing. You are not doing things independently or individually. Another thing, clear roles. These are characteristics of any team. There should be clear roles. What is each person supposed to do? Apart from this, there is effective communication. So, as a team, if you can't communicate, that cannot be an effective team. There is also measurable processes and outcomes. So, apart from that, we also have leadership. So, a team supposed to have leadership, and then benefits of effective teamwork. Now let's get to look at each one of them. We see how they work as principles. So when you talk about shared goals, what is it really as a principle of an effective team or a health-based care? So when we talk about shared goals, the team, including the patient and where appropriate, even family members or just other support persons, generate a common and clear defined purpose that include collective interest and demonstrate shared ownership. So There are a lot of people that are going to come together. What are our interest? What is the interest of the patient? What is the interest of the health practitioner? Even at sometimes, what is the interest of the family? So when all these get to come together, they are going to demonstrate shared ownership. So it is not only this person who is a boss. It's not only this one who is a boss. So there is a coming of together, sharing of goals, sharing of purposes. So you need to have defined purposes. Why are you exist? Why is this team there? So it should be a defined purpose. Not I think we are there for. You don't think, you need to know why this team is there. So that is having shared goals. So everyone comes to bring their ideas together. Now when you talk about clear roles, there are clear expectations for each team member, functions, responsibilities, and accountabilities, which optimize the team's efficiency and often make it possible for the team to take advantage of division of labor, thereby accomplishing more than the sum of its parts. So each person has got a responsibility. Because each person has got a responsibility, everyone has got something that they are going to be held accountable of. So if one thing is not done, people are going to look up to you. Why is this not done? Because it is your responsibility. This is not there for troubling you, but just to make sure that there is optimum efficiency. And it makes possible for the team to take advantage of division of labor. So there is need of division of labor, not where labor is just concentrated on one person. So division of labor has to do with working. Okay, let's get to divide. Instead of me just getting to do this alone, we are going to do it together. So that is division of labor. So when you talk about effective communication now, this is crucial for the teamwork success. Very important. Imagine this is a team that cannot communicate. So effective communication is very important for success in a team. Imagine you want to ask for something, you could not do it better, and you just keep quiet. So we need effective communication in a team. So the team prioritizes and continuously refines its communication skills. It has consistent and accessible channels for complete communication and used by all team members across all settings. So that is effective communication. There is need and proper effective communication. Now, what about measurable processes and outcomes? So, reliable and timely feedback on successes and failures should be agreed and implemented by the team. These are used to track and improve performance and immediate put strategies for the future. So, that is measurable processes and outcomes. So, if you see that there is something that you are doing well, you have to have a reliable and timely feedback. You need to have a feedback. Are you succeeding in achieving the aim, or are you failing to do it? There is need for that feedback. And if there is need for any improvement, then the team has need to make tactics. How are we going to make sure that things get to work in the right way? How are we going to make sure that we get to accomplish if we are failing to? So that is measurable processes and also outcomes. So there is also need for leadership in a team. So when it comes to leadership, effective team leaders facilitate, coach, and coordinate the activities of other team members. Effective leadership is a key characteristic of an effective team. Whenever there is no leadership, there is difficulty in operation because there is no one to control this person. So leadership is important to make sure that there is effective operation, to foresee that everyone is doing their duty. If people cannot do what they're supposed to do, leadership has to come in and get to speak. Why is it that you are not able to do this? So that is why there is need for leadership in any effective team or a team-based healthcare. So this can be administrators who make sure that policies are implemented. So there is also benefits of effective teamwork. That is one principle. So Effective teams can improve care at the level of organization, the team itself as a whole, the individual team members, and the patient. So there are benefits. That is, there is improvement in care. Okay. Your aim is to see that, remember, this is a team based healthcare. So there is improvement in healthcare delivery. That is the benefit of an effective team. The things that you are battling with, the things that you could not achieve alone, you can achieve it in a team. So there is an improvement that is seen. That is the importance of being in a team, or a benefit actually, and one principle. Now let's get to look at a lot of benefits now of a team. What are the benefits of a team? So effective teams can improve, as I've said on the previous one. So they are able to improve things, effective teams. Now, some of the benefits of an effective teams. So there are organizational benefits, team benefits, and also patient benefits. Okay, and also patient. So now let's get to look at each one of these. So when we talk about organizational benefits, reduce time and loss of hospitality, and so there is just basically reduction of time and cost of hospitalization. Okay. As you get to operate together in a team and you form this team, which is an effective team, there is going to be reduction in time and cost of hospitalization. When you are an effective team, when you are a team that gets to work together, a lot of things are going to happen because this is an effective team working together for a common purpose. There is going to be reduction in what? Hospitalization. That is because you are cooperating with patients, you are working together with them, and where there is cooperation with them, you are getting to listen to patients, you are getting to treat them well, you are getting to work together with them. Well, there's going to be just that reduction, that reduction in this kind of troubles and problems that these patients are getting to face. And so there's going to be reduction in what? Hospitalization, and also reduction in time. So that is one important thing when it comes to organizational benefits. And also there's reduction in unexpected admission. Just on the organizational benefit, unexpected admission. So where team members get to cooperate, because you are able to cooperate with a lot of people, even some things which are unexpected are going to be reduced. For example, unexpected admissions, where just things you don't even expect things to happen and they get to happen in that way. When people are sick, they will not just be unexpected the admission admitted. This is a team, and we are saying this team is comprised of not only health practitioners but also patients and also their families. So when someone is not feeling well, when someone is not sick, these things are not going to be unexpected. So it is going to be a benefit to the organization in that there's going to be no unexpected admissions and unexpected just things happening unexpectedly. There will be a knowledge because there is this cooperation for a common good with patients and also just members. So also services and are bettered, and there is accessibility of the services by the patients. That is also one thing that is better. Services are better. So when you get to talk about an effective team, this is one benefit. The services are going to be improved, and so the patients are going to be able to have access to these services better. So when we talk about now a team itself, and one benefit of a team apart from the organization, a team is there to make sure that the organization is running. But a benefit for the team itself is there is improved coordination of care. So there is going to be improved coordination of care. People are going to be able to coordinate. Team members are going to be able to coordinate, and that makes caring get to happen. So each person gets to care even for the next one. And there is also efficient use of healthcare services as a team. When you get to cooperate, you have got that more chance of using some things that you cannot use alone. So efficient. Apart from you just being able to use things, you are going to use them efficiently other than you using them just alone. So when people get to work in a team, there is an efficient use of health care services. Why? Why is this efficient use of healthcare services? When you get to use something efficiently, you are using it just enoughly, not misusing it. You know that the goal here is to make sure that work is done. So even as you get to work, the way you get to use things, you are going to make sure that you use them efficiently. You don't misuse things. And even if you get to misuse them, well, there's someone who is going to ask you to explain why you are getting to misuse things. So that is why there is efficiency. And also there is enhanced communication and professional diversity. So communication gets to improve when you get to work in a team. That is one benefit to a team itself. Enhanced communication. So apart from that, now what are some of the benefits now to the patient? So there is an enhanced satisfaction with care. So there is satisfaction with care on the patient side. The team is working, they are doing all they can to make sure that the patient gets to have proper medical attention. So there is satisfaction with care. The team is operating and they are doing everything they can just to show that care for the patient. And then there is also acceptance of treatment. Patients are able to accept treatment because they know they are in proper hands. They know they are also included. They know they are also important in the system. So even if there is need for a treatment, they are going to be able to accept. So there is also improved health outcomes and quality of care on the patient side. Where there is cooperation, even the conditions where the patients are, they are going to be improved. And because there is those improvements, even the outcomes are going to be good. Imagine a patient is in a place where it is dirty, there is dirty water. How does someone even get cured? So it might not happen. So apart from that, there is also enhanced well-being. Just the general well-being of a patient is going to be enhanced. That is because they have got even that peace of mind. They are free with the team. They are part of the team. They are considered as part of the team. So they have got that, just that morale of getting also to participate and get also to contribute. Now let's look at some of the challenges to effective teamwork. So the first challenge to effective teamwork is changing roles. Apart from changing roles, there is also changing setting. So we also have healthcare hierarchies. That is one also challenge. Alright, so apart from the healthcare hierarchy, we also have individual nature. As a challenge to effective teamwork, individual nature of healthcare. And then the next one, as a challenge, there is instability of teams. So apart from this, we also have practical strategic approach. Okay. So this one is not going to even be under challenges. So let's first talk about resolving disagreements. This is also one challenge. And then the last one that we're going to talk about is failing teamwork. Failing teamwork leads to accidents. So let's start with the very first one. We get to understand what does it mean as a challenge when it comes to effective teamwork. So changing roles. In many healthcare terms, there is considerable change and overlap in the roles played by different healthcare professionals. These changing roles can present challenge to teams in terms of acknowledgement and role allocation. So there is need for changing roles to different people. There is need for people to swap roles, or maybe someone has moved out. So there is need to change a role. So that gets to happen as it gets to act as a challenge, because imagine you get to change roles and then there is just that challenge, like are you going to give that role, and just the acknowledgement for people to get to accept other roles which are getting to change. So that gets to happen as a challenge. Apart from that, there is also changing setting. So when it comes to changing setting, some changes in the nature of healthcare, such as increased delivery of care for chronic conditions, require the development of new teams and the modification of existing teams. So if there's maybe a condition that has come, and that one requires more time from the healthcare team, well, they might not be able to do it, because they know, no, us, our job is only this part. So in that case, there is going to be need for establishment of a new team, or even get to modify the team that is already there. So that is one challenge that also gets to happen: the development, the increased delivery of care for chronic conditions, those conditions that gets to happen there and then, which are very bad, which needs some more attention. So healthcare hierarchies are also a challenge. The strongly hierarchical structure of healthcare can be counterproductive to well functioning and effective teams where all members' views are considered. So you see, you've got in this team, you have got your bosses, you have got people you are leading, you have got small positions. It can be a very big challenge when it comes to making decisions. So those who are always considered as bosses will just be considered as, will start thinking as if every decision they make is law, because they take it like they are leaders because they've got these big positions. So that can act as also a very big challenge. Also, individual nature of healthcare. So many healthcare professions such as nursing, dentistry and medicine are based on the autonomous one-to-one relationship between the healthcare provider and the patient. While this relationship remains a core value, it is challenged by many concepts of teamwork and shared care. So when you're talking about individual nature of healthcare, there are some positions which are just to be one, which are just supposed to be one-on-one interactions between the health care provider and the patient. For example, a doctor. You don't need to be in a team for you to be able to deliver this. But when it comes to a team, this is one of the things that you get to speak against. There is need for cooperation. Every member is supposed to have shared goals. And this is very difficult. So this is just the individual nature of the Healthcare, just a position in itself. So there's also instability of teams. Some healthcare teams are just transit transitory in nature. That is coming together for a specific task or event. So there is that instability. For example, trauma team. So some healthcare teams are transitory in nature, coming together for a specific term, task or event. So that is why there is instability. These teams just get to come together when there is only this need, when there is only these things that is supposed to be done. So that comes to act as an instability, because at times it becomes very difficult to get to organize something so quickly, get to organize a team so quickly that hasn't been operating. So that is an instability. And also, let's get to look at resolving disagreements and conflicts. So the ability to resolve conflict or disagreement in the team is crucial to successive teamwork. This can be especially challenging for junior members of the team, or in teams that are highly hierarchical in nature. So just resolving these disagreements is one thing that is very difficult. So there are a lot of disagreements that can get to happen. So this is just a strategy that needs to be done. We will not get to consider it like a challenge, but this is the nature that everyone should develop, being able to resolve disagreements, because disagreements are a challenge to effective teamwork. So there's need for being able to resolve them. Now, failing teams lead to accidents. That is one challenge. So reviews of high profile accidents have identified three many types of team failings, namely unclear definition of roles. So if there is unclear definition of roles, and also lack of explicit coordination. So there is lack of coordination. Apart from that, also miscommunication. These things lead to accidents when it comes to a team. When there is no clear distribution of roles, when there is no coordination, when there is miscommunication, these are the things that get to act, or that get to bring failing teamwork. And these failing teamworks are going to lead to accidents. So that is why a team has to be stable. There should be definite roles, coordination, and also good communication. Well, thank you so much for being present in this tutorial. Stay blessed.